From vaccines to variants and doubling up on face masks, COVID-19 headlines are still constantly changing. But in recent weeks, Hawaii's new case counts have been steady. Residents want to know if and when restrictions will be eased, but health experts are warning us to not let our guards down. Hear from top state and county leaders on where Hawaii is heading. Tonight's live broadcast and live stream of insights on PBS Hawaii start now.
Aloha and welcome to Insights on PBS Hawaii. I'm Yenji Denise. Next Thursday marks 1 year since the World Health Organization declared the coronavirus outbreak a pandemic. Since then, we've all had to adjust to this new reality. With disciplined health and safety practices and the vaccination rollout, there seems to be a light at the end of the tunnel. But could the new variants of the virus or vaccine hesitancy potentially threaten our progress? We'll ask our panel of top state and county leaders tonight on what happens next. We look forward to your participation in tonight's show. You can call, email, or tweet your questions, and you'll find a live stream of this program at pbshawaii.org and on the PBS Hawaii Facebook page. Now to our guests. Dr. Libby Char is the director of the Department of Health. The emergency room physician was appointed to the position by Governor David Ige this past September. Lieutenant Governor Josh Green is the state's COVID-19 healthcare liaison. A physician himself, he's had a leading role in the state's vaccination strategy and safe travel program. Derek Kawakami is the mayor of Kauai County. He's a third-generation Kauai resident and is in his first term as mayor. He's also served on the Kauai County Council and in the state legislature. And Sandy Boz is the managing director for Maui County for Mayor Mike Victorino. He plays a major role in the supervision and management of the executive branch. Thank you all of you for spending your evening with us tonight. Dr. Char, I want to start with you. Let's look at some numbers right now. Where it stands right now in terms of the vaccination, there have been over 380,000 doses administered in the state. Close to 16% of the population has achieved at least one dose of that vaccine. How do you think the rollout is going? What do those numbers tell you?
I think we're doing really well as a state in terms of getting people vaccinated. One of the things that we're trying really hard to do is that when the vaccines arrive on our shores, that we get it into people as quickly as we can in a very safe and effective way. And we're seeing that, over 80% of the doses, once they arrive in Hawaii, are getting into people within that first week. So we're very, very happy with that. I think the other thing is, unlike other states, we have different counties that we have to get that vaccine to, and we have ocean in between us. So I think that's going well also, that we're getting vaccine out to each county, and they're doing a great job administering it.
Lieutenant Governor Green, Joy in Kaimuki says, now that the age requirement has dropped to 70 years and older, when can we start signing up for the vaccine? We've got so many questions already tonight, people just wanting to know when it's their turn.
Now, and we can get through the 70-74 group quite quickly. There are 146,000 individuals between the age of 65 and 74. And so Director Char made that order just a couple days ago. We're signing those people up. They'll start getting their shots on Monday. And then we'll be able to move to that next category of 65 to 69-year-olds. These are the most vulnerable people in our society with the highest mortality risk. So it's very good that we're there. We're trying to balance, though, of course, making sure people who are in the essential workforce get safe, get vaccinated, and are kupuna.
Mr. Boz, we've had some issues with Maui County. When we look at the vaccination rate, it seems to be one of the lowest percentage when it comes to the total population with at least one dose. Also, there seems to be an uptick in Maui as compared to the other counties in actual coronavirus cases. What's going on there?
So for a number of different factors, and I want to appreciate Dr. Char and communication with her and her staff dealing with this idea that we're getting less doses than the rest of the state. In reality, what it looks like is we have not gotten less. We've just been doing it a little bit differently, getting it into the system via paper and then entry later. And she has sent the FEMA support staff as well down here to help us make sure that we're uploading the data properly, making sure that the vaccines that are getting into arms are getting counted properly. They have been providing us with a number of doses that is equivalent to our population, adults. And we appreciate that. We're getting those into people's arms, working with our district health office, a lot of good partnership in getting those pods or those points of distribution activated and those arms again. The Maui Health System, our hospital, our one and only major hospital here on Maui, has also been very active in getting people vaccinated. They are getting vaccinated on a regular basis. They've ramped up significantly this week and next week, the week after, and they've actually going to double, tripling the amount of doses that they've administered. So it's really something that it may have looked like we were behind, and we may have been a little bit behind, but it's really just a matter of making sure that we're getting everybody vaccinated. That we talk about elderly. Elderly have been a challenge. A lot of the vaccination channels have been electronic, right? And people don't have a problem with email. You have phones, email, computers, things like that. So our Maui County Office on Aging has really been assisting those elderly and by a phone or sometimes in person with me, actually getting them registered, getting them in place, and getting them vaccinated. It's been a big coordinated effort, but we really appreciate everybody there.
Dr. Char, I saw you raise your hand there. Would you like to add to that?
Yeah, I just wanted to comment. I think everybody's looking really finely at numbers, and I think if we take a step back and remember that these are people we're dealing with, I think Maui's doing a great job. I mean, they are getting vaccine into people in so many different ways. They are using, going to the long-term care facilities. They're going to the small independent places. They're doing mobile clinics to target hard to reach areas and people who otherwise may have transportation challenges. They're doing pods at the hospital. They're doing clinics. I think they're doing a great job. And I think, for whatever glitch you see in numbers now, that's going to even out fairly soon, just as more vaccine is out there. And I think some of it was a little bit of a strategy. And so we've been working together, and I think the strategy's been changed a little bit. And I think that too, you're going to see a real difference in numbers, within maybe a couple of weeks. But I think Maui's done a great job. I know I was hearing a lot of chatter, and I kind of disagree with it. I think they're doing just fine.
Mayor Kawakami, I want to get to you. It was announced this week that Kauai will be rejoining the Safe Travels program. What changed your mind? Why did you decide that now is a good time?
Well, we factored in a number of things, but we had always intended to get back into Safe Travels. It is a program that works. We needed some time to build a strong foundation, and we on Kauai, we're a smaller island, so we really wanted to prioritize vaccine distribution and focus all of our efforts to getting as much vaccines out there into our community, so that we could accept that higher level of risk that does come with travel. We also took a look at positivity rates, and I mean, the entire state of Hawaii is at an all-time low. The mainland seems to be in a decline. We're still looking out on the horizon as far as the variants, but we're also getting more vaccine. We're getting Johnson & Johnson, and our team here on Kauai has been going full throttle with vaccine distribution. And one thing that really helped us out was the visitor industry itself. They worked with Senate President Kochi, Rep. Tokioka, Fred Atkins from HTA Kauai, and we had a number of hotel property managers say that, hey, when we get back in, we don't just want to be a part of the economic recovery. We do want to play an active role in disease management and mitigation as well. We've identified a cheap source of testing. The margin of error seems very low. And on our own dime, we want to engage and start testing visitors and our workers as well. And that really helps with the detection side of things. And also, our local hospitals have been fabulous with adding capacity, having treatment available just in case somebody does get sick, that they can make a full recovery faster. So it's a lot of different factors that have really lined up things well for Kauai so that we can open back travel, get to that new normal sooner rather than later, and to help out those businesses that have been suffering for so long.
Now, I want to follow up on that. When you say that you want to add testing, are you talking about doing secondary testing at the airport, or what are you looking at?
No, this is outside of any county or state program, right? This is what happens when you build that sort of public-private partnership. This is something being done independently. The hotels will be working with a third-party contractor. They are setting up the process of how they are going to report back positive results, and what happens if a positive result happens to confirm. So it's really a big factor that allowed us to accelerate our reopening or re-opting back into safe travels. So it's a program separate from the county and the state. This is something they're doing on their own.
Okay, Dr. Green, please go ahead. I know you raised your hand there for a second.
Yeah, their opportunities are here now because we've seen this really steep decline in the last 60 days after the surge that we had over Christmas, New Year's. We've seen a steep decline in our case averages. We're down at 43.4 statewide cases per day. Also, we've seen a really steep decline in our individuals in the hospital, which Derek was referring to also, that people are doing better because they're vaccinated. We strategically vaccinated our kupuna and those who live in nursing facilities. So that, combined with people who are in care homes also, those were our most vulnerable people who, 2 months ago, we were 100% higher in the hospitals. And now that those individuals have a measure of safety with 2 shots plus 2 weeks, so they got full immunity, I wouldn't say we should take risks, but we are positioned to be a lot safer in general for our people. It doesn't mean we should let our guard down, but it definitely means that we have some new possibilities that we can undertake. And I completely agree with Derek that testing is so valuable, so we can have a spotlight on where the disease is and all of this data that we've been compiling. So we've moved into a place of much greater safety, but we'll still have to monitor all of these things, like whether or not we get the variant out of the UK, like if we get the variant from South Africa, because things can change quickly. We've seen that before.
Dr. Char, what is the status of variants in our state right now?
We've been doing surveillance since about June, and we do have some variants. The one that we had initially tagged back in, I think it was early February, as the L452R, was very new then. We didn't know a lot about it, and since it's been renamed as the B1429. We do have a bunch of cases here. Statewide, we're seeing it. A few cases on Maui, there's a few on Oahu. We're keeping an eye on it. So far, we haven't seen it like in California, where it was just spreading like wildfire, but it's definitely something to watch. And I think the reminders, we still don't know that much about some of these variants and exactly how they work. But it's thought to be a little bit more transmissible than other COVID. And so that's why it's of concern to us that it could spread quicker.
Dr. Green, I want to ask you about the Johnson & Johnson vaccine that is now starting to make its way into the state. Do people have a choice as to which vaccine they get, and how will they know, before when they sign up? Is it something that's disclosed at that time, or, if you have Dr. Fauci has says, if you have the option to get a vaccine, get whatever is available. What's your guidance in terms of what vaccine to take and how you can, make your choice known?
Well, first, my guidance is usually listen to Dr. Fauci because he's just terrific. Okay. Yes, we've got 11,900 doses in this first week of the Johnson & Johnson vaccine. For everybody's knowledge, you know that there were 2 shots for the Pfizer and Moderna. And they, when you've had both shots, give you 95% immunity, that amount of protection. The Johnson & Johnson is kind of a different variety of vaccine. You only have to get 1 shot. It's very good. It stops the possibility that you're going to catch COVID by about 66 to 72% based on what the studies have shown. But it also prevents 85% of serious illness. And over the first 28 days of the study, when people were in the studies, they didn't see fatalities. So it's very protective. My general guidance is yes, you should be able to always choose which vaccine you want. That's important. We have not seen a lot of side effects from any of them, but there have been some. Choice is critical because this is a very stressful period for our whole state. However, I think this is a big weapon in our arsenal because since it's just 1 shot it can help us with a lot of the challenges we face. For instance, we want to open up schools. A lot of people may have been reticent about getting 2 shots, getting some side effects after that second one. Now they're more ready to get that Johnson & Johnson shot. It's also easier to deliver. The Johnson & Johnson shot doesn't have to be kept at super low temperatures. So for instance, some places that we have that are very rural in our state, and we are a rural state, like Kauai, where I was the doc many years ago, it's difficult to get there sometimes with some of these other vaccines. So there's lots of opportunities. I know that it's a game changer in a positive way. And they're also continuing to do more research and studies to make sure it's going to be effective for populations everywhere. I would even add that, you heard about the variant, the South African variant, how bad that was. It wasn't responding. Well, they're now using this Johnson & Johnson vaccine almost exclusively down in South Africa because it's working. So lots of pluses here, but people should make a choice when they sign up.
Mayor Kawakami, there's been some discussion about allowing people to travel with a so-called vaccine passport. They would get to bypass the testing requirement or the quarantine requirement if they had verified vaccine. How would you feel as mayor allowing people to come into your county with a vaccine passport?
I think we've been consistent from day one as far as taking guidance from the experts in the subject matter. And in this case, when the CDC makes a ruling and we hear from Dr. Char and from our higher ups, we'll be ready to go. I think some of the details as far as how do we validate that vaccine cards are not being counterfeited is an issue that's being worked out. They're taking a look at how long these vaccines are effective for. And so for us at the county level, we just make sure that we get the infrastructure in place so that when that call is being made, we're ready to go from day one. But I am very optimistic that vaccine and vaccine deployment is going to be a huge key to sort of getting back to what has been said over and over, which is the new normal. And we're just waiting to see what the guidance looks like. And when that time comes, we'll be ready to go.
And Mike in Makiki has a question for the Lieutenant Governor, which is when will people that get the vaccine be able to travel without restrictions? Of course, you're leading the vaccine rollout, but safe travels is another thing that you have been spearheading. So what's the time frame on that?
Well, in my mind, ideally, and as Mayor said, we do need that verification from the CDC and guidance from the scientific community. But it looks good, and I'm hopeful that it will be May. The reason I say that is we are starting to get some very good data. I've been in contact with some of the individuals from Israel. Israel did a mass rollout of the Pfizer vaccine. Former Prime Minister Netanyahu was in contact with the Pfizer folks, and they bought a lot of it. And then they've been able to share data and see whether or not only does it prevent the spread of the virus of COVID-19, but also does it offer what's called sterilization immunity, meaning it knocks that virus out of your upper respiratory area, your membranes, your throat and your nose. And their data looks good so far. You can't have too much data in a circumstance like this because, heck, we've had 115 million plus cases that we've confirmed and many more for sure. But I'm very high on this. And it's obvious to me that over time, the international and the national community are going to use this as a guide. Remember, the test was always very helpful from a safe travel standpoint, but it wasn't foolproof. And so a lot of the counties did good things. They added extra tests. They were careful. But actually being vaccinated gives you that extra assurance and really the ability to plan for your travel. And often it's a long trip to here. So I'm enthusiastic about that. We will, of course, wait on the final guidance, but that's the key to opening up in a more vibrant way for our state safely. And in many ways, that will be the key to economic recovery because as of now, we're still around 12 or 13,000 visitors a day, as opposed to 30,000 where we used to be. This will take us well into the 20,000 plus range. And so people start getting their lives back a little bit.
Mr. Boz, what's the view from Maui County on a vaccination passport and allowing people to travel without having a test if they have that verified?
Really, it's the same. We want to make sure that we're following guidance that's been data to analyze and make sure that we're doing this properly, make sure that there's no counterfeiting. We've been managing the inter-island screening process for a number of months now, and we found people who had they want to bribe the screeners, they provide false documentation, those kind of things. So it is a concern. We want to make sure that people really are vaccinated. And we do want to make sure, as mentioned, does the vaccine really stop the virus completely, or are people just carriers? Really concerning. We've had a number of cases over here. We've been doing testing of voluntary testing of travelers, secondary travel testing about since October 18th. And, so we do catch a few there, but it is something that has happened. We also have community testing as well, where we're testing pretty much anybody who wants to get tested, whether they have any symptoms or not, whether they're in close contacts or not. If they just want to get tested, they can come and get tested. And, we've done 25,000 tests or so with that program. And it's about a 2.3%. It's really, it is trying to really just cipher out how many COVID positive people we have and deal with them. The State Department of Health does a great job of contact tracing, identifying, isolating, working with us to help to reduce spread of health. But if people are coming in with positive, being positive, COVID positive, it's going to still just be seeding our communities. It's really critical that entry point.
Dr. Char, Dr. Ryder from Maui says Kaiser doesn't list obese or stroke patients on their comorbidity list for 1C. How will these and disabled people get vaccinated under 1C and when? I think, going back to where we started, there's just a lot of people who want to know when it's my turn. And, if you have a chronic health condition, how do you know that you will qualify, or if you do qualify? And then what will the sort of process be? Do you have to bring a letter from your doctor to a vaccination center? How are you doing that?
That's a great question. So under 1C, it's people 65 and older, and it's also essential workers who were not included in 1B. And additionally, there is a huge category of people 16 and older that have comorbidities or other health problems and issues. As you can imagine, that would be a tremendous challenge for the people at the vaccination sites if they were trying to interpret letters from physicians, or if they were trying to figure out, who had a more significant comorbidity. And the whole point is really that we want to get people vaccinated. And so we convened in conjunction with the Healthcare Association. They've been tremendous partners through this. And the Healthcare Association and the Department of Health, we had a clinical expert from each county and also from each of the major health systems. And so we've had a couple of sessions where we got together and really discussed it and looked at the data. And I think what we're seeing is that there is a correlation between the comorbidities as well as age. And so I think we're probably going to end up using age as a surrogate, and then also carve out a few, very serious illnesses or conditions. And so those very serious illnesses or conditions will be invited to please come and get vaccinated. And then additionally, we will probably just be expanding 1C and going through in reverse chronologic age. So where we're opening it up to 70 and older now, I anticipate once we hit 1C, it's 65 and older, and then we'll just keep backing it down and inviting more and more people. And that seems to correlate very well with the comorbidity, so it should kind of take care of it. It makes it easy for the screeners when people are registering and whatnot to use age instead of having to really try and delve into somebody's personal medical history or something along those lines.
So Neil on Facebook has a similar question. Is asthma a pre-existing condition to get this vaccine? If not, why not? So are you saying that there will not be sort of an illness or a comorbidity verification? It'll just be age, or there will be certain allowances, and if so, which ones?
Well, again, I think, if we're going to use specific illnesses, I mean, you can imagine that would almost be infinite. And who is going to do those screenings, and how is that going to happen? And if you have to go to a doctor to get a letter, that really puts a lot of people at a disadvantage if they don't have a primary care doctor or something. So what we were seeing was that there was that correlation. And so I think that's a reasonable surrogate. It's logistically feasible. It makes sense from a healthcare and a public health perspective that we don't need to ask people for, each of the specifics on what sort of illness they may or may not have. And instead we can use the age as a surrogate marker for that. So I think if we follow in reverse chronologic order, going from, age 75 and above, age 70 and above, pretty soon age 65 and above. I think it will also take care of that, people with comorbidities for the most part. And then we will have an additional side category for those who have some very obvious and very significant illnesses that we will add them. And I think LG looks like he wants to chime in on that.
Yeah, I agree with Libby. The director's right that it becomes worse as you are older with serious medical conditions. And when people, for instance, have these severe conditions like requiring oxygen, that is a very high risk for an individual if they were to catch COVID, because the lung conditions can then lead to severe illness, intubation, or even dying. Being on dialysis, again, a lot of people are very frail if they're on dialysis, and that was worked out well with the Healthcare Association by Director Char and her team. Also, there are other considerations. Some people have all kinds of other needs, but it's not exclusively those lung conditions. Like if they have cancer and their immune system is very suppressed, that's another one where sometimes you can discern that they both have that condition and need it. But it's difficult because there are some privacy matters, but we're not going to be heartless either. This is not done in a vacuum. There are times, obviously, when conversations are had when someone's in very grave condition. We've been vaccinating a lot of people that are already in institutional settings where they have these health conditions, and that's why they're living there, and they're getting vaccinated because of the setting itself. So a lot of these things are done clinically, but the most important thing will be to get through our whole population. And to get hung up on one condition or another could really delay that. I also think that, as Mayor mentioned earlier, we're getting more vaccine now, not just the Johnson & Johnson, but we're also getting more of the Moderna, more of the Pfizer. We may even get a fourth or a fifth vaccine in the coming months approved. We're hopeful. So all of these things bode well. And when we were previously tracking towards the end of the summer or fall, we now are hearing from the federal government they're going to try to get us there by the end of May. That might be a little bit optimistic, but our state's pretty small and we've been very efficient. So keep your fingers crossed that we won't be struggling over one condition or another, that we'll instead be vaccinating large swaths of the population quickly.
Mayor Kawakami, there's a question here from Brock on Facebook, says, ask the panel what their plan is to help small businesses across the state. We know that in Kauai, in part because of the restrictions that have been in place for public health reasons, businesses have been particularly hard hit there. What is the plan to help those businesses? What kind of relief is out there?
Well, the federal government has a number of programs that, at the county level, we've been able to assist through our Office of Economic Development. But very quickly, right from the get-go, what we did is we created a pandemic response team, and then through OED, we created the Kauai Economic Recovery Strategy Team, which is really a partnership with the public and private sector, brought some of the best minds together to start formulating short-term immediate relief, whether it's creating rise to work programs where we were able to partner people that were unemployed, that couldn't get their unemployment checks, or maybe perhaps didn't qualify, partner them up for employment opportunities with third-party private nonprofits to get work done, get a paycheck, and if they needed health insurance was covered as well. We did business boost grants where we just got CARES Act money and just funneled it as quickly as possible to as many small businesses as the CARES Act was intended, to get that money as fast as possible out into the community to infuse our economy and help, provide a flattening of the extreme downturn in the economy that the whole world was facing. And, we're watching what Congress does with the stimulus bills moving through the Senate. As soon as we get some guidance and we get some extra resources dropped down to us, we plan on just utilizing the existing infrastructure programs at work to be able to continue to help small businesses. But I have to tell you, keeping an island in Tier 4, which is basically as open as we're allowed to be, helps small businesses, because restaurants can open up at full capacity as allowed. You have a high level of consumer confidence that if I go shopping or if I go and actually eat in a restaurant, I'll be safe. So I think it's a number of things, but Come April 5th, we're hoping that's going to be a huge support system to our local mom and pops, and then be able to contribute to the state's economy as well. And just moving forward, I know that our CURSE team is still fully activated and taking a look at immediate relief that we can provide. But I think the biggest thing that we can do as a community is understand that we are all in this together. As we get back into safe travels, now is the time that I'm going to plead with our residents of Kauai that it's go time. We had a number of days where, you know, we were able to build a foundation to get back into safe travels. And the mitigative measures are very simple. Wearing masks work, you know, maintaining some sort of distance between people. And if at all possible, if you can avoid large gatherings, if you can resist the urge and understand that vaccine deployment is getting out, that is a key component to disease prevention and mitigating risk. I think we're going to be seeing a light at the end of the tunnel sooner rather than later, but this is a collective community effort. This is something that I think as a county, we have been able to understand, undergoing a number of disasters and coming through every adversity stronger and smarter than before. That ability for Kauai people to come together, it still exists, it's still strong. I think it's going to be one of the biggest problem solvers that's going to let Kauai emerge from this sooner rather than later. So I'm telling businesses to remain optimistic. Brighter days will be ahead.
Mr. Boz, I want to ask you, Ku'ipu and Mililani has a question sort of statewide, but I want to direct it to you first. What is the state planning to do to monitor tourists arriving from irresponsible states that lifted mask mandates? We do know that Texas made big news today, the governor there saying that they're 100% open for business and that they do not require masks there. When you have residents from those states coming to visit your county, how do we reinforce the mask mandate and what steps are you taking there?
You know, I think it has been a challenge. You know, we've been open ever since the governor opened up the state. We have been accepting tourism here, and if you look at our tourist numbers, we are getting almost as much as Honolulu. Every day we get a large number of tourists here, and they come from all different kind of states. Most of tourism that arrives in Maui comes from the West Coast. We do have some from Texas and other areas that have bigger challenges. It's a matter of making sure that they've tested, that they're negative when they come here, making sure that they've followed all of the pre-travel testing rules and the safe travels program, that it does work very well when it's in place. When people try to skirt the system or they don't, then we arrest them. We come over here and they haven't tested properly, they don't want to follow our rules, they don't want to quarantine, then we arrest them, we'll send them back home to wherever they came from. We don't want tourists here that aren't going to follow our rules. Mayor's been pretty adamant about that. We go out there to tourism areas in Lahaina and kind of public areas. The police department does go enforce over there. They're over there issuing citations. Just in the last week, they issued over 100 citations to tourists who aren't wearing their masks. Occasionally to locals too, but people who they're not maybe not used to it because they're from a state that doesn't wear masks. But if they're coming here, that's our rules. They follow our rules. We'll make sure that.
Dr. Green, there's a question here. David and Diamond said, how in the world can the lieutenant governor suggest people should ask for their choice of different vaccines? HPH is using Pfizer, Queens is using Moderna. Which organizations will receive the J&J remains to be seen. Does he seriously think patients should refuse to be vaccinated because their choice of vaccine is not available through their healthcare provider? What do you say to David and Diamond Head?
Well, my personal advice is take whatever vaccine is in front of you, because I feel confident that any of them are adequate to protect a person. There's almost no difference whatsoever between the Johnson & Johnson and Moderna, but we are going to have pods that are specific to the Johnson & Johnson. For instance, Department of Health will be running a pod, I believe this Friday. They're going to focus on educators, is my understanding, and they're going to focus on that vaccine. If someone didn't want to take the Johnson & Johnson, they could go on a different date, a different day, and sign up and take the series, the 2 sequence of shots from Pfizer or Moderna. So people can make that decision. But my advice to David and to others would be, at this point, I think because we've gone through the strong majority of 75 plus and other vulnerable individuals, that the lesser vulnerable people that are now getting vaccinated would do well with any of the shots. After all, the most important thing is to not face serious illness or mortality. Now, I had COVID. I went through COVID in September, and it was quite scary. As a 50-year-old with COVID, I worried not only about whether or not it could progress. I had a 51-year-old friend who died, but also my family. You don't want to spread it. But the good news about getting the vaccine is that you lower that rate of potential infection by so much. And if you take the good advice that Mayor Kawakami just mentioned, which is continuing to wear a mask, you're not going to spread or catch the virus. But I can say with some confidence that you'll have choices. And as we go forward, we're going to have more and more vaccine available. A lot of people have made their minds up and may not have gotten vaccinated yet. I think it will be kind of a smaller and smaller subset of people going forward that will be in that space, but people will have a choice. So I hope people are patient. It is, of course, difficult, but imagine this. We're here on, what is this, March 4th. We've only been at this for about 2 months. And it feels like a really long time because people are so eager and enthusiastic to get vaccinated. But in just 2 months, we've given 380,300 and I guess it was 10 shots. It's a lot of shots. And so we're going up every week. People will have choices. But last time I'll say it, if there's a vaccine offered to you, take it.
Dr. Char, on the same issue, Beverly in Honolulu says, for high-risk individuals, will they be able to have a choice of which vaccine they receive? Viewer does not want the Johnson & Johnson dose. For people who are trying to weigh which vaccine should I get, sort of a similar question to the one Dr. Green just answered from David. What do you say to Beverly and others who feel like they want one over another?
That's fine. I think the whole point is to please get vaccinated because we know that it works. And we know that all 3 of those vaccines will protect you from serious illness, hospitalizations, and death. They're all very effective against that. And that's really what we're asking out of the vaccine. They're all voluntary. You can get, all 3 vaccines will be out there shortly and people can get whatever vaccine they want. But as Dr. Fauci was saying, take whatever vaccine is before you would be the smart thing to do. But yes, people absolutely have a choice. We haven't forced vaccine on anybody. It's entirely your choice.
And Cynthia, I want to stay with you, Dr. Char. Cynthia on Facebook says, other states are, as of last week, already vaccinated people ages 65 and the group of 1C. Why is Hawaii so behind in getting to 65? So why are you doing this in 5-year increments as opposed to allowing 65 plus?
I don't think we're behind at all. I think we're actually doing very well. We've had a very targeted and very tailored rollout. I think it's gone well. We've made sure that we're getting the most vulnerable in our community. Other states had opened it up early on to 65 and it was just chaos. You had people camping out overnight waiting to get vaccinated. And then they ended up backing off and going back up to 75. So I think we've been very reasonable. And if you talk to people who have been vaccinated, there's almost no wait. I mean, they get in there, they get vaccinated, and they're done in 30 minutes. And that includes 15 minutes of waiting after your vaccine. So I'm very happy with the way it's been going all across the state. I think each county is really doing well with it. And we're being very focused in making sure that the vaccine is there for those who are at highest risk. And then as soon as we can, we open it up and we're adding more people. So I think it's just a matter of being targeted, and the way we're doing it is preventing people from having to wait in lines for hours and hours.
On that same topic, Dr. Green, Jen from Facebook says, can there be consideration for drive-through vaccinations such as Aloha Stadium parking lot, since it is difficult for many kupuna to arrive at vaccination sites on foot? We know that we have the Blaisdell and Pier 2 as mass vaccination sites. Are there plans for any others?
Right now, we do have enough capacity, and I will ultimately defer to Director Char on this matter, but we have been doing about 50 to 60,000 vaccines a week on our great weeks. We have the capacity to do between 80,000 and 100,000 shots already per week without difficulty. It's just been a matter of getting enough vaccine. Now, as far as drive-throughs go, they actually did that on Maui, for example, and then people sat in their car, waited the 15 minutes to make sure they didn't have any allergic reaction, and then went on their way. So we are being a little bit more creative. Also, you're going to see a lot more vaccine opportunity at pharmacies as we go forward, especially with this new vaccine that doesn't require the deep freeze technology. So there will be more creative events. You can be sure that we're going to do all that we can in all the counties, and the mayors have all been exceptional. I mean, they've stepped up on this matter. They all want their people to be vaccinated as soon as possible. Some of the stuff we've done is not required a drive-through. We've driven to people. Special shout out to Eddie Mercero at the Department of Health with Dr. Yozawa and Dr. Toma. They put together a plan where they go into the small households for the very elderly and give them their vaccines if they have needs. So I would expect a lot more of that. Eventually we'll get to the primary care provider community, and they will also be able to do, I would guess, some house calls. So lots of this will evolve in the coming months. But if we continue to do this well, we will be vaccinated by the summer, maybe even the early summer. And the last remaining people that haven't gotten there will find creative ways to get to them.
Mr. Paz, I'd love for you to talk about the outreach efforts on Maui to get to some of the places that Dr. Green was talking about. And if you could, can you project just a little bit more? We're having a little bit of trouble hearing you.
Sure. Sorry. I don't do a lot of interviews. Anyway, I do. We are working very hard. Dr. Pang has been working with a lot of different providers to get out there into different areas, as mentioned, and especially Maui has had clusters. We've had some hot spots that we're dealing with, and if we can address those directly. One example of that was in our jail. We actually went out there with a provider, contractor that went out there to assist in vaccinating those inmates right away when we started an outbreak over there. Something that we could work together to organize. We've been going to long-term care facilities, as you mentioned, just it's really a matter of addressing it, identifying where we can get there, organizing it so that we make sure we have enough vaccines and doses to take care of those that are there and get out and get them vaccinated. It's really been a big coordinated effort. We've also worked with the National Guard, gone out to Hana, a remote area over there. The Queens has a hospital in Molokai that they've been working with as well, and Lanai, Straub, and others that are helping with the smaller communities in islands in our community, make sure that they are getting vaccinated on a regular basis, getting their first. So, it's just a big logistical effort. We want to send a big kudos out to every single one of our partners, because it really does take a master plan to get this done. We've been working so hard on this, and Dr. Green said, and then it's only been 2 months or so. It seems like it's been 2 years because it's been such a focus, and really making sure that people do get vaccinated in every step of the manner. As I mentioned, even with our Office of Aging, getting those that can't technology, getting them organized. We have another provider that will actually go pick them up on a bus, bringing them to the locations to get vaccinated. Again, these are the different areas and how we make sure that we get this hard to reach.
And Mayor Kawakami, how are you making sure that everyone, especially people who live in more remote areas, that everyone does have equal access to the vaccine in your county?
Well, what I do is I let the experts run the show without getting too intertwined into the details. And I think in a large part, that is why our vaccine pods and our partnership with our hospitals and of course Longs Kapaa has been fairly successful with covering the bases as far as having a well-organized vaccine plan. I know that they have been able to delegate tasks, so it's clear what the hospital partners are in charge of as far as the age bracket. The Kauai District Health Office pods are taking a look at federal guidelines as far as the critical infrastructure workers, frontline workers, and working through those categories. And of course, they are always collaborating with our other partners to make sure that we have vaccine deployment going out to nursing homes. And then even within our Agency of Elderly Affairs, which is under the county jurisdiction, under Kealoha Takahashi and her group, they are constantly going out there to take an assessment of those kupuna that may have challenges getting vaccine. But in the meantime, this is a huge collective effort. Whenever we hear of a victory like Molokai and Lanai perhaps being the very first islands to vaccinate their entire population, like I think everybody from every county is cheering, because the bottom line is this: the race is on. The overall strategy is to get as much people vaccinated as possible so that we can achieve what they call that herd immunity. And so if we see success elsewhere, we're cheering. When we start seeing states like Texas dropping mask mandates and these people are going to be vacationing here in Hawaii, we're racing even harder, because if we can mitigate risk by vaccinating our population, I'm not as concerned if other people are getting vaccinated or not. That is going to be a risk that those people are going to have to take. I'm worried about the state of Hawaii being able to cover our bases with our own people. And so it's a huge global effort. And I think, a lot of people has popped up, they're wondering, well, where am I? I have this particular ailment, I'm this age. People have to understand that we're trying to keep the process very simple. If we overly complicate this, it's going to slow things down, and that does nothing to get your vaccine sooner rather than later. So that's a very complicated answer to a very simple question. So I apologize, but this thing ain't simple.
Dr. Green, I want to ask you, this is from Melissa on Facebook, says, Pacific Islanders have been getting hit with this pandemic so hard. Have you set up vaccine sites in public housing? How do we make sure that everyone has access, especially folks who may not have a primary care provider?
Yes, we do. And so we know that the Pacific Islander community, specifically the non-Hawaiian Pacific Islander community, which represents about 4% of our population, was spiking at like 30% or more of the cases of COVID. And also, that was reflected in the hospitals. A lot of our community was very sick. So in these demographics, we did empower the Department of Health, and we encouraged the director, and she stepped up to this challenge to go and do some additional vaccinations in very high-risk areas. Public health is a complicated matter. It is never simple to boil it down just to an age category or even a disease state, because you have these health disparities that exist. We've long seen that in the Hawaiian community. The Hawaiian community has had to endure a lifespan of 9 years less on average than other people across the state, because they don't often get as much health care, treatment for diabetes, hypertension, and so on. In this particular case, the Micronesian community got slammed, in many cases because they were living in multi-generational households and were really struggling. So we're able to get, with some of our mobile capacity, we're able to get to some of the communities with some extra vaccines. It's very difficult also because the perception of playing favorite to some group, one or another, is a challenge. We don't want to decrease our confidence as a state. We want to, like Mayor Kawakami was saying, get everyone vaccinated. But there is reason to take a little extra attention and extra vaccine to certain populations for the good of all, so those individuals don't suffer and that they don't spread it widely in the community. We've seen the greatest risk individuals get vaccinated. I'll reiterate, first 1A was 50,000 people. That was healthcare workers and kupuna nursing homes. 1B was the 109,000 individuals that are 75 and older, plus some additional infrastructure workers that could spread it a lot. And there's a reason that we have the lowest rate in the country, because we've been very strategic. Lowest rate of COVID, lowest mortality rate by a big margin as compared to any other state. And some of that's been through the very hard work of Department of Health, making some pretty tough judgment calls to go and do extra vaccinations when there's been a hot spot. We'll see a lot more of that going forward. But first, we want to, again, try to stay the course and not miss days vaccinating, not miss out when there are shipment delays, not miss regions. Everyone, we're trying to treat them equally.
Dr. Char, I want to ask you this one from Kaipo, who says, Dr. Fauci is still telling people that once you get the vaccine, that you can still get COVID and give it to others. Why are the panelists calling it a game changer, that everything will go back to normal? How should we behave once we have gotten either 1 or 2 doses of the vaccine? Certainly not back to normal, but why will it be a game changer?
I don't think we're saying that everything will go back to normal. I think we're saying that it's a game changer because it will make a tremendous difference. There's nothing that's 100%. So even though you've been vaccinated, there's still going to be a slim chance that people can get infected with COVID. And I think we need to be cognizant of that. And that's why we still need to wear our masks and keep our distance until we get our herd immunity. That being said, the vaccination is extremely effective. And if you happen to get COVID after you've been vaccinated, the disease is much milder. Your chance of ending up in the hospital or getting really sick from it are very minuscule. And so that's why it's so important for people to get vaccinated. Certain populations, I just want to kind of piggyback on what the Lieutenant Governor was saying. we are the State Department of Health. That's what we do. It's public health. And so with regards to some of the other communities and populations that are having a little bit higher manifestation of COVID, we absolutely are aware of them and trying our best to help. And it's really that community effort. So we're trying to get the churches together with the federally qualified healthcare centers, or FQHCs, and the Department of Health has Pacific Islander investigation teams and outreach, and there's a whole community helping to deal with this public health pandemic. And so we are absolutely trying to reach certain populations. The game changer is that some of these vaccines now only require a single dose, so that's going to make it much more feasible for people to get their full immunity a lot easier and a lot quicker than if you have to do the 2 doses and make the second appointment and follow up and whatnot. But the vaccine will be a game changer because it will protect our community.
We only have a few minutes left, but I want to read these 3 questions, but they kind of sum up the frustration that I see in a lot of the comments we're getting tonight. Tom in Kailua says, why can't a 60-year-old with several extremely high-risk health conditions get their vaccine yet, but a healthy 70-year-old can? Nancy in Waikiki says, has a 96-year-old mother on the mainland. She can't see her until she's vaccinated. She's 64. Can people be vaccinated in emergency situations? And another person writing in, why is it wrong for a disabled person to get priority? They may be less able or mobile, so they shouldn't be discriminated against. Dr. Char, I'm sure you hear this all the time. Why isn't it my turn yet? What do you say to these 3 people? Because I think they sum up the frustrations of so many.
I think there's a lot of frustration, and I think it stems from people just really wanting to get vaccinated. And for that, we're actually very grateful that people in our community want to get vaccinated. I think our number is something like 91% on the last survey are interested in getting a vaccine. So that's a good thing. We are being very focused in our rollout so that it's not chaotic, so people don't have to stand in long lines and wait overnight to try and get a vaccine. We are doing a good job. The more vaccine we get, the faster we can move. We just opened to 70 and above yesterday. I don't think we're going to stay there for very long before we start moving into 1C. I think that's right around the corner. And that is 344,000 people just in that category of people with comorbidities. If you look at the entire 1C, we're talking 500,000 people. And so again, we want to do it in a very reasonable, well thought out strategic way so that it's not chaotic. It's coming. We will get you vaccinated. The whole goal is to get everybody in our community vaccinated that wants to be vaccinated. It's coming sooner than later. And I think now we're starting to pick up momentum with these additional doses of vaccine, 3 different choices, more pods, hospitals, FQHCs, pharmacies, federal retail pharmacy program, long-term care facilities. We're picking up steam, and it's going to start moving a lot faster.
Dr. Green, I see you nodding there.
Yeah, a month ago, we were sitting at less than half this number of vaccines given to people. And so you can see it trending upward. I would never minimize someone's frustration. And I know that nor did Director of Health Char, but you do have to realize that if a person is, 70 and there's another person there's 62 with a challenge, a healthcare challenge, if you try to make one exception, the whole system can fall apart. And that doesn't mean that there aren't circumstances in which people get vaccinated, but with extra need. But we are doing a large public health initiative. This is the largest public health initiative that the state has ever taken upon itself. And we're trying to do it in a very condensed, tight way to make people safe, to give them some sense of normalcy, to get schools back open, to get the economy back open, to get people to visit their loved ones, whether it's on Kauai or Maui or on the mainland. All of these considerations are right there. I would just say this to people: take a deep breath, be very safe, continue to wear your masks, continue to socially distance, continue to wash your hands. Very low risk you're going to catch COVID. And you're going to wake up one morning and we're going to flip that switch and your category is going to come up very soon. So I'm optimistic that Hawaii is going to, at the end of this, have the lowest death rate, the lowest case rate, and the highest number of people getting vaccinated. But we can't do it all in one moment because we don't have the vaccines in hand. We will, though, by the end of May, very likely have gotten to all the people that would like to be vaccinated. And before too long, in the next few weeks, the highest and most vulnerable people will be vaccinated.
Okay, well, thank you so much. Mahalo to all of you for joining us tonight. We really appreciate you, and we thank our guests, Department of Health Director Dr. Libby Char, Lieutenant Governor Dr. Josh Green, Kauai County Mayor Derek Kawakami, and Sandy Boz, Managing Director for Maui County. Next week on Insights, it's been called a hidden epidemic. More than 100,000 adults in Hawaii have diabetes, with another 400,000 on the verge of being diagnosed. We're going to dive into this public health crisis, so please do join us then. I'm Yanji Denise for Insights on PBS Hawaii. Mahalo for being here. Have a great night. Aloha.